Good afternoon, everyone. I am Jo Gray. I'm the Amend CEO and also an MEN2A patient. And I'm just going to give you a brief rundown on what's new in endocrine neoplasia patient support. So the panel today for the Q&A at the end is myself there on the left, Gill Masters in the middle, who is an Amend trustee and also an MEN1 patient. And on the right there is Kym Winter, who is our lead counsellor for our counselling service. The plan for the next half hour is to give you a brief update on our activities over the last couple of years and also our plans for 2021 and beyond. I will mention our Amend Research Fund, and then we'll have a short Q&A session. So for those of you who don't know, or for some reason are not on our mailing list, Amend provides information and support for patients with multiple endocrine neoplasia disorders, but we also have two other groups. We have a group for adrenal cortical cancer and also a group for inherited paraganglioma syndromes. So our day-to-day activities include developing information resources in lay language. So that's a language that's less medical and therefore easier for patients to understand. We have websites, we produce information booklets, we produce videos, and we run educational events for patients. Our support services include our wonderful counselling service, which is led by Kym, and patient support meetings. And on the research front, we award an annual research fund that I'll talk about later, but also we do a lot of our own kind of in-house surveys and that sort of thing. So the recent activities update, a couple of years ago, we realised that there were some rather large gaps that we needed to fill in our resources. And in particular, these were for adrenal cortical cancer and for inherited paraganglioma syndromes. So I'm going to update you on our activity here. So for adrenal cortical cancer, we recently developed 3 new patient experience films, and you can see in the bottom picture there that these are our 4 wonderful ACC patients who bravely volunteered to take part. And above are some of the experts from Birmingham who also star in the films. And we also updated the patient information booklet on ACC in conjunction with Neuroendocrine Cancer UK, with whom we share some services for ACC. And I'm most proud this year, of course, of the amount of work we've done for inherited paraganglioma syndromes. We have a new group and a new logo, and it's called Feopara Support UK. We developed a new website and a new patient information book, and also developed another 3 patient experience films. So there's a lot of work that's gone on, particularly this year, with regard to these diseases, and the separate website, you can see the address there. But of course, COVID-19 is the hot topic of the year, and what we decided back in March was to be obviously as proactive as possible to head off as many inquiries as we possibly could. So whilst Helen and I, who work in the office in Tunbridge Wells, had to pack up and head home, and are still mainly working from home, we've done an awful lot of work this year with regard to coronavirus. So we immediately set up some website resources, and these are still available and regularly updated as and when. We initiated a couple of surveys, and the first of which again was set up in about April, beginning of April, for tracking people with MEN who develop COVID-19. And more recently, we have done a snapshot survey of the impact of COVID-19 on the emotional well-being of people with MEN syndromes, and I'll cover both of those in just a minute. All our support and educational events immediately went online, including our patient information day in May, and our regional support groups, which turned into monthly informal Zoom gatherings for anyone who could make it. So the first survey that we set up way back in the first lockdown, there's a link there you can see which will take you to much more detailed information, but just a quick overview, which is that we've had so far 24 self-reported responses, 13 MEN1, that should say, 7 MEN2A and 4 MEN2B. Out of those 24, there were only 4 hospital visits, and only one of those as an inpatient, and that was a patient in the USA. Most of the cases reported were actually reported in March and April, and some of them even relate to potential coronavirus infections back in January. And since then, we've had just the occasional response to the survey. 58% of our respondents had not had a flu jab in 2019, so this might be something where we see an improvement in the rate of take-up for flu jabs, and hopefully that translates into take-up for the coronavirus vaccination when it becomes available. Only 5 of our respondents had a confirmed diagnosis using a test, but this is not surprising since most of these cases were reported in the rather long period where testing was just not available for the general public. And the symptoms probably won't come as much of a surprise: headache, cough, fever, high temperature, fatigue, and muscle aches. And like I say, at the link above, you can see a lot more detailed breakdown of those results. And the more recent snapshot survey that we've done on emotional well-being impact, we asked for people's feelings during their worst week of the first lockdown, and then during the week of the 12th of October, and the survey ran for a week from the 19th of October. And what we found that in line with a previous UK-based study, those with poorer health reported a slightly more negative effect on their mental health from coronavirus, the pandemic in general, and lockdowns. But we didn't see any of the other factors that have been highlighted in UK research, and that is young women with children at home. So we are slightly encouraged by these results, but we'll be keeping an eye on these as well and comparing them gradually over the next year. Now, the plans for 2021 are all obviously COVID willing, but our plans are to develop more patient experience films, and this includes for young adults to add to our resources already on the website. We're planning on producing 14 short films that are very social media friendly, and these will be on topics that are important to adolescents and young adults. And actually this project is already underway, and with filming that will probably start virtually in December. We're also planning patient experience films on MEN2 and MEN1 and potentially MTC as well. Our other big project for 2021 and potentially beyond is a rare endocrine tumour and syndrome toolkit for primary health professionals. And this is aiming to try and improve the care that patients with rare endocrine diseases receive in primary healthcare settings, and but also to hopefully improve the time to diagnosis, which is currently very, very long. So a quick mention of the Amend Research Fund. I added this up yesterday, and since 2012 we've actually awarded over £100,000 in research funding, which did come as a bit of a surprise to me. And in 2021, we also have another good-sized fund available of £40,000. This includes 2 special research awards for MEN1 of £10,000 each. And these are both in memory of people who have sadly died from MEN1. In addition, there's £20,000 more for research into any of the other conditions that we support. And you can find information about this again on our website. So that's our brief update, and I just want to say a huge thank you to everyone who makes our work possible, and that's our patient communities who are more than willing to help with any projects that we dream up. To our medical advisory team members who help to ensure that all the information we provide to patients is accurate. To our very supportive trustee board who are always there to help and advise, and to all our volunteers without whom we just wouldn't be able to do half of the things that we do. So now I'd like to just go back to our panel and ask and answer a few questions. Fantastic. Okie dokie. Kym, I had a couple of questions for you regarding the counselling service that you lead for us. First of all, have you noticed any regularly occurring issues being brought up during counselling sessions throughout this year's pandemic?
Interesting. I mean, inevitably the usual themes happen, so about people who are newly diagnosed coming to terms with having to integrate a fairly big piece of information about yourself into who you are and your life and the implications of it. So that stayed the same. For people who've come towards the beginning of the year, obviously that's been complicated by the fact that ordinary tests and scans may be delayed. So maybe taking longer to get that overall picture, which of course causes anxiety. Even for those who they aren't actually being delayed, there's a fear that they will be delayed. So there's a higher level of anxiety around the process. But I always think that first year of diagnosis is quite a vulnerable time. So there's been an added layer of anxiety because of the impact of COVID. We did expect to see more referrals at the start of the pandemic and were slightly puzzled that we were getting less. And then from asking around in other services, we found that there was a similar picture, that people were aware there was a lot of mental health issues, anxiety, worry, concern around, but people weren't approaching for help. And of course, it's hard to know exactly what that is about, but is probably a combination of, for some people, a lack of privacy in the home, that it's harder to have virtual sessions. If you've got people you fear will be overhearing, or you've got children around that need care, or those complications. Sometimes at the beginning, people were getting used to virtual appointments if they hadn't had those before. Of course, we've always run virtual appointments. It's always been part of our service. So we've been doing this for ages. What's the big deal? So I think that's in the mix a little bit. And I think also that people were psychologically probably battening down the hatches a bit. People were in that survival mode of, I just need to deal with what's immediately in front of me. Being able to create time or space to allow a bit of room for feelings might have felt quite difficult if you're in that survival, just keep on keeping on kind of thinking. But things have started to pick up again a bit more now, because I think people are coming to terms with how to navigate living through the pandemic and working with it and allowing ordinary life to have to be integrated in certain ways. But I mean, certainly, if anyone's listening thinking, is the counselling service open and available? Yes, as usual. And we can always think with people about how to find creative ways of accessing us, even if it's, you've got a busy household, or it's not easy to find time. We do a lot of car therapy. People sitting in their cars. We've had people sitting in garages. We've had a couple of people go for a long walk and sit on a bench on the top of a hill and talk to us. So we can think about what's possible. But,
and these are, of course, are all ideas that we're going to be sharing with the patient communities as well, to try and encourage them to access help when they need it. Yeah.
I think as well, I think, I do believe human nature is fundamentally quite generous, and I think some people have probably thought mental health services will be overwhelmed. I can hang on, therefore I won't add to the burden. Whereas actually I would always say, please don't feel like that. We are certainly not overwhelmed. You might have to wait, a few weeks to see us if we're full, but usually we can see you very quickly. So don't feel you can't make contact. We're still here.
And there are some changes coming up to the counselling service, which are quite exciting. But would you like to just run through those briefly?
Yeah. So we've been providing services for you for 5 or 6 years now, and we've been approached by a few other charities along the way to start offering counselling services for them too. So we've taken the plunge just this year. We're launching next week to say that we're now forming as a community interest company, so a not-for-profit, which offers specialist rare disease counselling to other organisations using the model that we've grown up with through men's work, really, and all that we've learned through working with the MEN population. So we launched this week, and we're just really passionate about making a difference to integrating mental health aspects of living with a rare condition into ordinary healthcare. So it's not seen as a sort of bolt-on, it's seen as part and parcel of good rare disease care, whether that's MEN or SDH or anything else. So yes, and we're very pleased you're on our advisory group, so that's helpful. So Amend has birthed this organisation in a way. So
great progress, and it's good to see so much interest in providing the same sort of support that we've done for years now. So that's
and that's that's been pioneered by Amend, really. You were one of the first organisations to get this off the ground, and people have noticed that, and it's exciting to take that forward.
Absolutely. Fantastic. And we've got some information about that in our newsletter that will be coming out shortly, and people can register for free online. So, and you'll receive that in December. That's lovely. Thanks, Kym. Gill, I had there was a couple of questions for you. Probably more about your experience with MEN1.
Okay.
Because you've been a volunteer in one form or more for Amend for quite a long time now, but and you talk to a lot of other patients as well with MEN1. I know I'm always referring people over to you on a quite regular basis. So do you have a feel for what the main worries are of a newly diagnosed MEN1 patient?
Yeah, I think there's a common thread that runs throughout most of their feelings, and it's not knowing. My GP hadn't heard of it when I was first diagnosed, and it's a very isolating feeling, and it's a very lonely place to be, I think, initially. The biggest thing that helped me, I think, was going to an Amend meeting and walking in and realising that everyone looked normal. I don't know what I expected them to look like, but that was a relief. And then a little bit further down the line, when you start understanding the condition, then you worry about things like what does the future hold in terms of my health, my job and my financial situation, all of those things begin to, because it's an unknown and it's a disorder that you can't predict easily. So you never really know what's going to happen at any point in time. But you learn to live with that not knowing somehow. It becomes part of your normal, really.
Yeah.
I think
You
that's
worry
really,
about. Sorry?
that's really I was thinking, Jill, one of the phrases we use in the counselling with people is often that you end up having to grow muscles for uncertainty.
Yeah.
By default, because you're having to sort of heavy lift uncertainty all the time.
Yes.
In different ways. So you find your way with it, but it takes practice over time.
Yeah. I think sometimes it has to come out of the box at certain times. If you've got a consultation coming up and you know you're going to have to sit and discuss things, so you let it out of the box and then you deal with it for a couple of days and then you put the lid back on and carry on with your life. And some people are really good at doing that and some people really struggle, and that's probably my biggest my understanding has had to broaden hugely because I very quickly realised that not everybody's like me, and you have to not judge people for the way they deal with it because it's not wrong. There's not a right and a wrong way of dealing with it, and there are so many different ways. Some people worry tremendously about passing the disorder on to their children, for instance, and then maybe another patient will say, well, it's not your fault, you know, you can't help it, but we're all different. So yeah, it's been an interesting journey, and I quite easily put the lid on it these days, but it's taken me a number of years to get to that point.
So how were you first diagnosed, Jill?
Oh, that's a bit of a long story.
Nutshell.
I was sitting waiting for a blood test for high cholesterol in my GP surgery, and I was reading the screen as you do when the nurse had gone out to get the needles and things, and it said probable hyperparathyroidism, and I'd never heard of it, and it was dated back to 92 when I'd had my son, who was admitted as an emergency at 6 days old for neonatal tetany, and nothing really happened then. They checked me and my calcium was in the normal range, so it didn't ring any alarm bells. And then 16 years later I spotted this and questioned what it was, so they redid a blood test then and my calcium was very high. So that was 16 years after the first opportunity for somebody to have noticed that was, you know, there was something wrong. And yeah, it went from there. So I had one adenoma removed from a parathyroid gland, which should have normalized my calcium, and it didn't. So I had to have a second operation and they took 2 more glands away. And that was when it solved the issue of high calcium. But that's what prompted the MEN diagnosis, because hyperparathyroidism within MEN1 presents as hyperplasia, which affects all glands, and that's only a small percentage. 85% of people with primary hyperparathyroidism will only have one solitary adenoma, and once that's removed they're cured. So yeah, multiple gland removal is a trigger for an MEN1 test. And that was how I found out.
Amazing.
I know.
16 years, and you know, I just hope that
and then by chance, you know, if I hadn't have seen it,
I think this is the thing. Yeah, I think things may have improved sometimes depending on who you see first, but you know, it still takes a long time in many instances. And of course, you know, the later you diagnose somebody, the worse or the poorer the outcome may be.
Yeah. Yours wasn't quick either, was it, Jo?
No, no. Well, not. It didn't take quite as long as you. But, you know, I saw numerous GPs, which is where my big concern in primary care comes from, and early diagnosis, because I saw many GPs after the birth of my first child in '96, and then I'd had symptoms before that anyway without really realising what they were. I thought that was just me, and but they really came to a head after childbirth, and sort of it was headaches, absolutely vicious headaches, and vomiting and trembling and just feeling absolutely dreadful. And eventually it died down a little bit, and then I had my son, and they got worse again, and they were just relentless. And eventually, you know, all the GPs insisted that there was nothing wrong with me, and that it must all be in my head, and that I must be postnatally depressed, which I knew I wasn't. But when you have so many people telling you that that must be what's wrong, you begin to think, well, maybe it is. And I was put in a psychiatric hospital. It was a nice one with carpets and stuff, but nevertheless, it was still a, you know, you couldn't open the windows more than an inch, but it was still a lifesaver for me, because there was a consultant clinician who used to do the rounds there every few days. And I think he looked at me and thought, I finally bagged one. He tests for pheochromocytomas all the time, or he did when he worked there. And I was the first one that he found in 20 years. And so after that, obviously, I went into a proper centre and was diagnosed within, I think it was a year in the end, or maybe 6 months. It's a very foggy period of life.
It's amazing that it sounds like you were diagnosed on a stroke of luck, really.
Again, yeah.
I think it's quite often the case. Yeah.
It does make me think too about one of the things that I'm often very thoughtful about with our population is those who may have been misdiagnosed with a psychiatric condition, and the impact that then that might have on how you interpret or understand anxiety or depression post-diagnosis of something like MEN or the SDHs or whatever. Because of course they are in and of themselves, that sort of diagnosis is anxiety provoking and can leave you low. And I sometimes worry, well, I know that sometimes it can inhibit people approaching us, because inevitably if you've been misdiagnosed, you would refer thinking, well, my mood is entirely now driven by my hormones or my tumours, therefore there isn't a psychological component. And of course the two, you know, the two are related, and often there is a bit of detective work as to what is to do with what. But I would always encourage people not to fear contacting us because they fear being sort of misdiagnosed again. You know, we're very pragmatic about the inevitably this sort of diagnosis is in itself going to stir difficult feelings that it might help to have help with or work through.
Absolutely.
It's complicated for people.
It is, and I think you know, both Gill and I were diagnosed some time ago now, and as I mentioned, I think things have improved slightly, but you know, still I think the average time to diagnosis in most of these conditions and neuroendocrine tumours, etc., is 4 to 5 years. And that's still, you know, 4 to 5 years of pain and not knowing what's happening to you. And that's why I'm quite passionate about this project next year, about the focusing on primary healthcare, so that we really get the word out there and really try and help not just those who already have a diagnosis and are trying to deal with perhaps a slightly unhelpful GP or whatever that is, but also maybe just making some primary health physicians go, oh, actually, yeah, I do remember something about that. Maybe that's worth looking into, and hopefully we can improve things that way. But yeah,
no,
I think it is. Sorry, Kym. It is thinking outside the box, isn't it? You know, they work to a set of guidelines with cut-off points. And some people will think beyond that and some won't. And it's finding someone who is sympathetic with your undiagnosed condition and has the time to listen apart from anything else, I think.
Yeah.
And one of the things we're trying to look at with Rare Minds is sort of saying to mental health care professionals, could there be a physical driver for some of the mood conditions? You know, if someone is terribly anxious or terribly low, just having a little bit on your radar, could there be a physical route to that? Yeah. But equally with the medical professionals also saying, could there be a driver that's an emotional driver of some of this degree of anxiety or low mood? So you know, you're sort of trying to encourage either side, whether it's the physical healthcare professionals or the mental healthcare professionals, to bear in mind the other aspect, you know, the other end of things. So you know, it's a good, I think this project would be really good to do, Jo, as well. It's, you know, really needed.
Definitely. Well, ladies, that's sorry, I'm going to cut us off there because that's our time is up. But I think this has been really interesting. Actually, I'll be quite keen to do more of this sort of thing because I think having a bit of a you know, brainstorm and an update for people, etc., might be quite useful. So hopefully we can do this again. So thank you both. Thank you to Gill.
Thank you.
And also a big thank you to everyone, and particularly all our NHS health workers at the moment who have, I know from being at the BES this week, have been doing an incredible amount of work to keep services running as best as they can this year, and I really want to sort of pay a good tribute to them, so thank you.